Good afternoon, everybody. My name is Meredith Fink. I am a certified coder with the MTBC, and I will be your presenter today for the Icd-10 General Code Set training. I do ask everybody to write any questions down that you may have after the webinar. You can type it in, and we will try to get all the answers answered if we have time at the end of this webinar. If not, we will follow up with an email on the answers. Okay, so let's get started. Okay, so if you have any questions, what you would do is you would put it in the question box, type your question, click send, and we'll wait till the end of the WebEx to answer the questions or attempt to do the best we can on answering any questions. If it's a general question, we can bring it up. If it's more specific, we'd have to take it offline. MTBC Company was founded in 1999. We currently serve 60 unique medical specialties in 42 states. We have over 2,000 employees with 24/7 operations, so we are open 24/7. We are ranked among the Deloitte Technology Fast 500. We're also listed on the NASDAQ. We have 3 international offices, and we are SureScript certified solutions provider. Okay, so basically we're going to go over the basics, the comparisons of Icd-9 versus Icd-10. So here's the things I will be going over the WebEx today in. It's Icd-9 versus Icd-10 structure, the similarities and the differences between Icd-9 and Icd-10, the addition of the seventh character describing the encounter. The seventh character is going to describe the encounter for different specialties, So seventh character used for fractures is going to be different than the obstetric, the OBGYN for obstetric. There is a placeholder that is something new in Icd-10 that Icd-9 did not have. Excludes 1 note, excludes 2 note, and some examples. Okay, so right now, Icd-9 has 3 to 5 characters. The first character is numeric or alpha. Characters 2 through 5 are numeric, always at least 3 characters, and the use of a decimal after 3 characters. Icd-10 has 3 to 7 characters, 3 characters before the decimal, and up to 4 characters after the decimal. The first character is alpha. The second character is numeric, and characters 3 through 7 could be either alpha or numeric. Alpha characters are not case sensitive. The tabular list, chronological list of codes is divided into chapters based on the body system or condition. That's already in Icd-9, and it's going to also be Icd-10. There will be, just the difference would be, there is minor exceptions. So they did restructure the eye and the ear. They separated that from the nervous system chapter and moved it to their own chapters. That's really the only change. Okay, so more similarities to Icd-10 is that the index to alphabetical list of terms and their corresponding codes. So for instance, it still has alphabetical in the beginning of the Icd-9 code book, and it does have the list of the terms and their corresponding codes. It's indented with subterms which appear under the main terms. The same structure as Icd-9, alphabetic index of diseases and injuries. They have the alphabetic index of external causes, the table of neoplasms, and then the table of drugs and chemicals, broken into sections. Many conventions have the same meaning for abbreviations, punctuation, symbols, notes such as code first and use additional code. Non-specific codes are unspecified or not otherwise specified are available to use when detailed documentation to support more specific code is not available. If it is available, it's important that you be more specific. I understand Medicare is going to be looking at this, and other insurance companies, they are going to be looking for the more specificity. The purpose of Icd-10 is for the more specificity, okay? So, for instance, now, I'll give you a couple examples to explain how it works now, and it will work also at ICD-10. So in the book now, you, for instance, have congestive heart failure. You will look in the alphabetic list of terms in the beginning, the alphabetic of diseases and symptoms. You would look under for CHF failure. Then you would go to heart if it's CHF, and then you would look for congestive. So again, its indented subterms appear under the main term. So it's the same type of code book. It just has additional information. So again, just like you code from the ICD-9 book, you're going to do the same thing with the ICD-10. You have to always code from the index, which is the alphabetic part, and then you have to confirm your code in the tabular section, which is the numeric section at the end. Very important. Just like you do it, you should be doing it now with ICD-9. You should be doing it with ICD-10, because there will be references on if you shouldn't be using that code. Okay, so very important to do that. Okay, so the differences from ICD-9 to ICD-10 is there is an expanded detail and specificity. So codes reflect modern medicine and updated medical terminology. Laterality, they want to know what part of the body, what side of the body has been affected, and that has been added. So you would see left leg, right leg. So you do need to document, you need to see the documentation and make sure that the provider or the medical assistant does indicate in the medical record which side of the body is affected. There has been expanded use of combination codes, so they may have acute on chronic codes where they didn't have them before, because they do associate the common symptoms and manifestations in addition to like diabetes. They do have combination codes. Poisonings and associated external cause. In the tabular, the injuries are grouped by anatomic site rather than type of injury. So that's the tabular, that's the number section at the ends of the ICD-9 code book. So we have fractures in ICD-9 was 800 to 829. The dislocations were 830 to 839, and the sprains and strains are 840 to 848. Whereas ICD-10, it's specific to the location of the body. So there could be fractures of the head and dislocations of the head from S09 to S00 to S09, and sprains and strains, but it's related to the head. Rather than it being specific to fractures, dislocations, and sprains and strains, it will be based on the injury to the head, to the body area. Okay, so there is the addition of the seventh character. That's new to ICD-10. There was never anything from ICD-9 related to this. So the seventh character is used in certain chapters. I have seen it in musculoskeletal, obstetrics, injuries, and external causes. They have different meaning depending on what section they're being used. Must always be used in the seventh character position. It cannot be in the sixth. So if there is a missing digit, then there needs to be a placeholder to make this the seventh character. So when the seventh character applies, codes missing seventh character are going to be denied. They're invalid. Okay, just like ICD-9, if you were missing a fourth or fifth digit, the same thing here. Missing fifth, sixth, or seventh digit is going to be a denial. Okay, so this initial encounter I'm going to talk about is mostly for the musculoskeletal section, for fractures, any kind of surgical treatment. So I'm going to go over a little bit with you on this. So, for instance, the initial encounter will be if there is active treatment. If the patient is receiving active treatment for this condition and it's not healing, it's not the recovery phase, it's going to always be the initial encounter. Now, there is different initial encounters based on if it's an open fracture, closed fracture, but they're specifically to initial encounter. Subsequent encounter, again, that's the second seventh character that you're going to be looking for. So the initial is usually A or B, the seventh character. The subsequent encounter would be D, G, K, and and P, depending specifically, you'll see that, but this is during the healing or recovery phase. So patient comes back into the office after having a knee replacement, okay? Now they're in the office and they're healing well. Okay, they're healing. The doctor's seeing them for their follow-up to the hospital, their post-op, visit. And they're healing. It would be under subsequent encounter. So you could use either a D, G, K, or P, depending on what the correct letter is, the seventh character. If the patient comes back for their post-op and they have an infection, okay, it's still an initial encounter then because they're not healing. So it's important that we know the difference between healing and recovery phase versus initial encounter. So it has to be documented. Patient is healing well. Patient has developed an infection. If we don't know that, we cannot code it properly. Sequela. Sequela is another one, and that's always going to be S as the seventh character. Complications or conditions that arise as a direct result of the condition. And this is after healing. Okay, this is after healing in the recovery phase. So it's like a late effect. They got a scar formation after the healing of the burn, the scar formation had come about. So that's the sequela. That will be an S. Okay. Now, if you were to use it for OBGYN, which is obstetrics, as a seventh character, the seventh character in OB is the gestation. So if it was a single gestation, it would be a 0 for the seventh character. If it was a fetus, if the patient had multiple fetuses delivered, it would be fetus, or I'm sorry, that they're treating the patient that has more than one fetus while pregnant. There would be 1 for fetus 1, 2 for fetus 2. So it is actually in order. 0 is the single gestation. If there's only one baby, that the patient is carrying. If there's more than one fetus that the mother is carrying, then it would be 1 for fetus 1, 2 for fetus 2, 3 for fetus 3. So depending, that's for obstetrics. Okay, so again, each section is going to have their own seventh character. It's not across the board. Okay. So I'm going to go on to the next slide. Here is where I was talking about how the active treatment, which is the initial encounter, active treatment would be A or B. Again, closed fracture or open fracture. The D is subsequent encounter, which is for healing. So, but in this sense, you're going to talk about what kind of healing: delayed healing, routine healing, if it's a non-union or a malunion, okay? And then, of course, S is for sequela, which I had said before. It will always be S for sequela. Okay, so here we go. So the addition of the dummy placeholder you would use if there is no sixth character or fifth character, you would need to use the X, okay? So it's going to be allowing for future expansion. You're going to fill in the empty characters when a cone contains fewer than 6 and the 7th character applies. If you need that code, if you look at the code book, you'll see it has so many digits, and if it's missing, if it's saying that this is the 7th character and you don't have a 6th character, you would use the X. X is not case sensitive, and these are just a couple of examples explaining. You'll see the first example has the A, which is the initial encounter at the end. But you also notice that there's an X here. The reason why there's an X is because it needed a placeholder. When the placeholder character applies, it must be used in order for the code to be valid. Very important. Okay, so excludes note indicates that the code identified in the note and the code where the note appears cannot be reported together because the two conditions cannot occur together. So for instance, the patient has diabetes with, an underlying condition. Let's say they have chronic kidney disease. This E10 is only for type 1 diabetes mellitus. That's all you know, you're going to use the E10. But if the patient has diabetes mellitus due to kidney disease, it's going to exclude it, because this E10 is only for the basic diabetes mellitus without any manifestations. Once there's a manifestation, it no longer, or if it's secondary, if it's not just the basic type 1 diabetes mellitus, it's going to tell you what is excluded. Like Icd-9 does that. That's why it's important to go to the tabular section of your Icd-10 code book to verify that if there's an excludes, then the excludes is going to refer you to where you need to go. So for instance, patient has gestational diabetes, you would never use E10, you would use 0, which is, O. And that's another thing you need to make sure that your staff is using the O versus a 0. They're always letters, so alphabet, the first digit. So you don't want them to use the number 0 for gestational diabetes. You want it to be the letter O, 24-4, and then there may be, other digits. It's going to depend on the situation. So we just put the basic information. But it does say that it excludes this, so that means you cannot use E10, okay? You would have to use one of the ones below. If there is no excludes, if what you're looking for is not in the excludes list, then that means you can use the E10. So and Icd-9 is the same thing. As long as you check the tabular section and read the whole section of the code that you're looking at, you'll be able to code properly. This is extremely important to get paid. Excludes to note indicates the condition identified in the note is not part of the condition represented by the code where the note appears. So both codes may be reported together if the patient has both conditions. So even though you have the L89 pressure ulcer, the excludes to indicates that condition identified in the note is not part of the condition, but they can be reported together. Okay? Next slide. I'm going to give you a couple of examples, and going forward, this is very important to try to use the extended codes versus using the general equivalent mapping. The general equivalent mapping that I have here is unspecified. Medicare does not want to see that we're still using unspecified. So normally in Icd-9, again, we have renal manifestations. I like the chronic kidney disease example. So 250.40 is diabetes with renal manifestations currently. That's Icd-9. For Icd-10, we have E11.29, that's type 2 diabetes mellitus with other diabetic kidney complication. And that should only be used if we don't know what the kidney complication is. But I do believe we need to talk to our providers and our clinical staff to make sure that we go forward using finding out what the complication is. If they don't know it at that point, they need to make it a point to find out what it is, whether, it's through testing, getting results from another doctor's office. Once they get the confirmation of what the the kidney complication is, it should be corrected in the medical record for future use. Because the patient comes back in the next time, you want to be more specific. You want to be, state that the patient, for instance, E11.22 is type 2 diabetes with diabetic chronic kidney disease. Now, the stages of kidney disease is what all the insurance carriers, and you'll see it at the tabular, that they do need to have additional coding for this. So if you know that the patient has chronic kidney disease and diabetes and it's related, and the doctor documents it that way, you use E11.22. The second code, and when you look in your tabular, it's going to tell you use additional code to identify the stage of chronic kidney disease. You now need to put what the stage is. And it is in numeric order. So N18.1 is chronic kidney disease stage 1. With the 0.2, stage 2. The 0.6 is end-stage renal disease. So it is very self-explanatory if you're using the code book that you need to use that second code. You have to have a second code. If you don't know it, there is an unspecified chronic kidney disease if you don't know it. But again, you get the testing from the blood work or the urine to verify what chronic kidney disease stage they are in. So the next time the patient comes in, you now correct it to what the correct one is. Anytime you see unspecified, we need to let the providers know, or if we are a provider, be cognitive that we need to be more specific, okay? And in addition to that, if the patient does have end-stage renal disease, we do need to know, we need to have it documented in the note that the patient is also on kidney dialysis, or if they refuse kidney dialysis. If they've been on long-term insulin, that's important too. So everything has to be documented, okay? Okay, so here's an example of the, the placeholder, or I should say the specific encounter, okay? Initial encounter, if it's the subsequent encounter. So this is just a couple of examples of the initial encounter on how the code would look and what they're looking for. So if you notice here, they're actually looking for if it's a current injury, if it's the right, what knee it is, and what encounter this is. It's very detailed. They want details. They need to keep these for statistics and, you know, just to be more specific. That is what ICD-10 was made up for. Okay, so another example is, in the past, if you did an annual physical exam on a patient, as a primary care doctor especially, you would do a routine general medical exam at the healthcare facility, and it was a V70.0. The new coding, they're asking for a little more detail. One is okay, there is an encounter for a general medical exam. We understand it's the same verbiage and we're looking for the same thing, but they need to know, is there abnormal findings or is there not abnormal findings? So if you have abnormal findings, you need to put the abnormal findings underneath the Z00.01. Any abnormal findings, you would, I'm sorry I don't have it on this slide, so if you can just write it on there. If there is any abnormal findings, this is with adults, with children, any kind of routine general medical exam, any code that says with abnormal findings, you need to indicate what the abnormal findings as an additional code. Again, if you look at the tabular and you go under Z00.01, it will tell you use additional code for the abnormal findings. So again, I just reiterate and let everybody know it's so important to check both the alphabetical, start off at the alphabetical portion of your coding, and then check it with your tabular in the back with the numbers and see if it refers you to anything else. That's very important. So here are some resources, tools and resources that MTBC does have. These are some websites that the actual website that you can go to. I don't know if you want to, actually you should have it on your slides, so you can always utilize those resources. And then here's some ICD-10 tools and resources for especially Medicare. Medicare will indicate what they're looking for. AHIMA, ICD-10, anything updated, okay? The ICD-10 watch will give you that information. So these are good sites to check on occasion, once a month, if you can, just check to see if any updates have been put together there. Okay, so let's see if we have any questions. Okay, so we have a question, and I'm not really sure about this answer. Will this slideshow be available after the webinar? I'm not really sure. We'll have to have somebody get back to you and let you know that. Okay, so if we don't, I'm not seeing any more questions. Okay, I do have. Can you please scroll back to the first few questions so I can take a screenshot? Okay, so, and is there any specific rules for neurology that you know offhand? I don't have anything specific offhand. I know I did see a lot of codes for migraine that indicated whether they, if it's intractable pain, non-intractable pain. I know a lot of codes have been added with more specific. Yes, that I've seen because I was putting together a crosswalk for headaches and migraines did have a lot of that. It had if it's intractable pain versus non-intractable, where here Icd-10, not a lot of codes had that. Okay, so then this the video of this webinar will be available on the mtbc.com website in a couple of weeks' time, so look out for that. Okay, so you want me to go back to ABC codes, the excludes notes, and the, okay, hold on a second. Okay, so again, the initial encounter will be if the patient is currently receiving active treatment. The subsequent encounter will be for any healing, and then the sequela will be for any late effects, any results from the condition, any complications or results from the condition after healing has been done. And we have the excludes note. Excludes one note indicates the code identified in the note, and the code where the note appears cannot be reported together because the two conditions cannot occur together. Excludes two note indicates that the condition identified in the note is not part of the condition represented by the code where the note appears. So both codes may be reported together if the patient has both conditions. You're welcome. Okay, so we treat epilepsy. Do you know if there will be also? Honestly, I would send in that question because I am not completely sure about specific specialties, and I don't know how to handle it. I don't want to take other people's time up on specific specialties, but if you have any questions, please send it to the email, and then we'll follow up with you. So every codes are very detailed, and we need to know everything wrong with the patient to code correctly. Yes, we should know that because honestly, that is the best way to properly care for a patient anyway, so we should know and it depends if it's going to be related to your specialty. So of course, if you're treating the patient for diabetes, of course, you're going to have a lot of documentation, but we do, what's wrong with the patient will have an effect on many ways that you treat the patient. So it is important. If for any reason you cannot get the data to confirm their, what kidney disease, and it's going to take you a little longer to get that information. I mean, you should basically go for it. Send the patient for the testing that's going to get them there. Otherwise, if you don't have it after a couple of visits, that's okay. But eventually, we do the insurance companies and everybody really does need to know more specifics. So yes, we can use unspecified if needed, but we do, recommendations are definitely try to get more specific, and we should know what the patient has because certain medications you can't give with other ailments. So it is important that you know everything about your patients. Okay. Where can I find a list of payable codes? Which diagnosis codes are payable for specific CPT codes? That's more specific. I can't really answer that question because it really has nothing to do with this website, this webinar. I would, again, send it in. Maybe, somebody could help you. Send in the email. But that's very much specific to many, many things. You can find that. Again, edema in the legs. You guys definitely need to get an ICD-10 book and start looking at these codes that you need for your offices and, verify. Again, the alphabetical section, look in first and then go into the tabular, and it will refer you to what you need to know. So I don't have, every code information that I don't know it all. I would have to use the code book to do that, and you really should start getting the code book. Okay, so the code books you can get through either the AMA, you can get them through the American Association of Professional Coders, the AAPC. It is called the ICD-10. Let me just get the code book. It should be the ICD-10. It's ICD-10 CM. I actually have the draft code book, clinical modification, but I can get additional information out to whoever has the question on what they need, how to get the book and the information regarding the book. Send the email in. And for anybody that needs to know where to get the books and what the title of the book is, I'll send you the information. Okay? But basically, I do recommend you guys start. You should have a copy of the book right now, because come October 1st, they need to be used. So getting the doctors and the clinical staff to start being more specific now would be an excellent idea, so that you're not trying to rush later to get this done. Okay, so they should really start getting into the habit of being more specific now. And then there's also testing, so you got to make sure that it's working. And then also, just in case there's any questions, you should really start having this into play, and you should definitely have your book. Okay, so let's see the email address. So this is where you would contact us for any questions. Okay, and let's see if there's any additional questions. But any questions that I couldn't answer, definitely send us an email. And I'm just trying to, okay. So I just wanted to let everybody know that I thank you for attending this webinar, and I hope that everybody got a lot of information out of it. And again, if you have any questions, please contact us at info@mtbc.com. Thank you for attending. Goodbye.